Here's
So
Jonh
cute.
Delaney.
So cute. Jonh Delaney. Adorable.
He's still in the race. Stalwell has dropped out. Delaney still in the race. Why? Oh, I don't know. He is mad. He's mad
I believe that.
that Bernie has hijacked the good name of Medicare to provide more than Medicare for people. This is a very weird construct, but it's his way of basically trying to signal to right-wingers. Now, on one hand, you got to applaud Face the Nation for having all the candidates on. On the other hand, it's like, well, I don't know. If you're going to have this dude on, why not Marianne Phillips? I mean, what?
Marianne Phillips. I am not familiar with her.
I mean,
I would definitely say that Marianne Williamson should be given double the airtime of Jonh Delaney. She's a much more innovative candidate.
There's your signature issue, as I know. And in the last debate, you said Medicare-for-all is not good policy and it's not good politics. But more than 8 of the candidates, of the 24 or 25 now, support this. Are voters just being misled by your fellow Democratic candidates?
Yeah, I think they're wrong. I mean, look at so many of the candidates, Senator Warren, so many of these people have outsourced their health care plan to Bernie Sanders, right? Because this is Bernie Sanders' plan. And it'll take private insurance away from more than half of the country, and they will reject that if we run on that. It'll also reduce quality and access in our healthcare system because Medicare doesn't reimburse sufficiently to keep.
Now, understand Medicare for all is a little bit of a misnomer. It really is Medicaid for all. And reimbursement rates may very well stay the same. Don't know under Bernie's policies, to be honest with you. We do know that there'll be a far less expense involved in administrative costs and dealing with insurance companies, broadly speaking. But also, costs need to be controlled. So is Delaney just going to wave a magic wand and get costs to be controlled? I mean, if medical providers are paid the same amount of money across the board as they are today, how do you control costs?
Quality and access in our healthcare system because Medicare doesn't reimburse sufficiently to keep all the hospitals and providers.
You were booed on the debate stage when you raised this, though.
I understand that.
So it does seem popular, at least with people who vote in primaries.
But here's the thing. Medicare for all is a great slogan. They've hijacked the good name of Medicare and applied it to a law that will cause upheaval in our healthcare system. And I was the first person to actually talk about this. Now we're seeing the debate change on this issue as people start to realize my plan, which is called Better Care, is a universal healthcare plan. Every single American gets healthcare as a basic right of citizenship for free. But I preserve options. If people want to opt out and keep their private insurance, they can. If they want to buy supplemental plans, they can. It's a much better way to create a universal healthcare system.
And non-citizens?
Non-citizens are not covered by my Medicare plan, but under my immigration reform, they will have legal status while they wait on a path to citizenship, which would allow them to then be covered. See, if you take immigration and healthcare together, you kind of see how we can start solving it.
Now, when he says that everybody gets health insurance for free under his Medicare program, but the risk pool is still going to be split up between private and public. What magic wand is he going to be able to use to make this thing work? He's lying. He's lying. It's not true. He can't do it. And this is when I say, like, Bernie Sanders has to go out there, and I don't know if I would say sacrifice is the right word, but he's got to tell the American public the truth. And the truth is, this is the only way it can work. Insurance is not outlawed in his bill, private insurance. But you need to be in Medicare. There will be a market for supplemental insurance, and it will be, even under Bernie's plan, bigger than cosmetic. You might. Unlikely that you would need it. Possible that you would want it if you have enough money to go with your fur sinks. But the fact of the matter is, You need to have a single payer to drive down costs, to eliminate the bureaucracies that are involved in just like, I mean, in my house right now, I have a file this big of like bills from my kids' doctor, pediatric doctors. And the bills like range from like $25 to $75. There's like multiple ones of them. I got to call them. I got to pay each one of them at a different location. I've got dental things. I'm waiting for the money that we spent on the dentist to come back from the insurance company. I mean, it is such a massive pain in the ass as a human being. But also from the standpoint of productivity, it's like, I can't believe I got to spend all my time on this shit. It's unbelievable. It's unbelievable that this is our system. It is just bizarre. There is nothing else that is even remotely as bureaucratic as this. I've gone in and I've got my driver's license. I've sold cars. I've got them registered at the DMV. I've registered to vote. I've filed deeds or whatever it is. None of that even comes remotely close to what you got to deal with the health insurance companies, private insurers. It's nuts. It's nuts. So Delaney's just out and out lying. And I if you're going to invite somebody on and you're going to ask them this question, you've done the homework. People booed you. Also do the homework on what the plan is. Right? I mean, come on. Give me a break. Ridiculous.